you've been told about it, and you know your face is going to be super tight and contoured, and lucky you, I just had one 2 weeks ago, so you can see I'm a little bit swollen. So what happens with a thread lift is your fat pads have migrated down, and we're moving the fat pad to the position it should be with the thread. The thread is a dissolvable suture, so over the next 4 to 6 weeks it will dissolve, and your own tissue or your own cells will cause the sling, so it will hold into place. That's the first thing. Because there's a needle, because it's a medical procedure, there is always a risk of bruising and swelling. You will have swelling, and the swelling will reduce over the next 7 to 10 days. The bruising is not similar to the bruising of a filler where it's just purple and a bit swollen. It tends to be yellowy because it follows a track, so you need to cover that with makeup. The other thing about a thread is that you can get a little bit of a dimple where the thread is going in, and that dimple will relax. If we relax it right now, you're losing the tightening of the thread. So we ask you to just leave it alone because the tissue will eventually relax around it. The other thing you might find with your thread is because we're moving fat pads back to original places where they should be, we're also in tissue that has nerves, vascular supply, vessels that can be damaged in some way. So what happens is you might find that you get a pulling effect. So you can't smile too much because it hurts. You end up not eating that much over the next couple of days. You end up just having some soup, which is great if you're trying to lose weight. But yeah, what you want to do is you just don't want to smile too much because you don't want to stretch your face too much. So you might have that resting bitch face for a bit. If you had it in your neck, you want to turn using your body. You don't want to turn using your neck for the next 5 to 7 days. One thing I personally had, which I always warn people about, is you can get like an electric sharp shock in some areas, and it's usually in this area here, because what's happening is there's a lot of nerves here. So that sharp shooting pain that you might get once or twice a day is because your nerve is re-innovating, it's reforming itself. It will go away in the next couple of weeks, and in terms of pain, it's like 3 out of 10. It comes and you're like, oh, okay, and just leave it alone, don't worry. The immediate thing I say after a thread lift is exactly what, follow the aftercare they give you down to a T. So they give you a neck pillow, they ask you to sleep with it, they ask you not to work out or run for the next 2 weeks, they ask you not to have facial massages, they ask you to take your antibiotics, they ask you to put antibiotic cream in, they put some steri strips on your face. We're going one step beyond what everyone else does because we want it to be an amazing result, and because we've placed it in the angle that suits your face. So do follow that aftercare advice down to the T, but ice your face as much as you can over the next couple of days too. That will be great if you can do that. One thing I will tell you, which the medical doctors will tell you or the team will tell you, is initially it's super tight and then it drops a little bit, and then as the thread is resorbing, it becomes tighter and tighter, and the thread just gets better and better with time. Like over the next few months, it just gets better and better and better. Any questions you have, any concerns you have, always contact the LMS concierge team or contact your aesthetic lead and we can answer them.